exam. So my name is Melissa Ward and I am a nurse, and I'm going to do the visual exam, the eyes, ears, nose, mouth, throat, lymph nodes, and sinuses exam today. We're going to start with the visual acuity. I'm going to have you use the Rosenberg chart. You would hold it 14 inches from your face approximately, and then cover your left eye and read the smallest line that you can.
LTFPH,
Okay.
2020.
And I'm going to have you cover your right eye and read it backwards, the smallest line.
HPFTL.
All right. And now uncover both and read the smallest line.
LTFPH, 2020.
Thank you. So both eyes, ODOSOU, are 2020. Next, what we're going to do is I'm going to go ahead and do the visual fields test. What I'm going to have you do is cover your right eye with your hand. I'm going to actually also cover mine on the same side. And what I need you to do is tell me when you can see my fingers come into your field. You're going to look at me.
Yes. Yes. Yes.
Okay, just stay there.
Yes. Yes. Yes.
Okay, now do your other eye. Look at my eyes.
Yes. Yes. Yes.
Okay, stay there. Now just switch because it's easier.
Yes. Yes. Yes.
Very good. So visual acuity is good, and the visual fields are intact. Peripheral vision is good. So the next thing we're going to do is inspect your eyelids and your lacrimal process. So if you could just close your eyes for me. Perfect. And then if you could just open your eyes. I'm just looking for excessive tearing or dryness, any kind of swelling or inflammation. Everything looks good, so no edema or redness, swelling, inflammation. Next, what I'm going to do is I'm actually going to pull the lower lids down so I can look at your sclera and your conjunctiva. Thank you. And I'm going to just use both fingers. I'm going to have you look down and left and right. Perfect. So the sclera is white, the conjunctiva pink. No abnormalities noted. Next, what I'm going to do is look at the cornea and lens. We have a fairly dim light, so I'm going to have you just go ahead and look forward at me, and I'm going to inspect. So the cornea is translucent, the lens is clear, the lens is also uniform. You can see the iris color behind without any cloudiness. Next, we're going to do your perla, your reactivity, just looking to see if the pupils are round, equal, reactive, and accommodating. If you could just look straight forward. Perfect. And the pupils are equal, round, and accommodating, approximately 4 millimeters dilated and 2 with constriction. Next, we're going to do the corneal light reflex. I'm going to move about 2 foot from you. We're going to dim the light, and I'm going to have you just look forward, and I'm looking for an equal reflection. Perfect. So pinpoint, equal, a little bit towards the nasal center of the pupil. Next, we're going to do your extraocular movement. I'm going to actually have you try to hold your head still and just follow my finger with your eyes. Start up here. Perfect. So No abnormalities. The general ocular movement is full. Now the next thing we're going to do is look for deviated eye. I'm going to just have you look forward. I'm going to cover and uncover one of your eyes, and all you need to do is just continue to look forward. Perfect. Perfect. So no deviation noted, no abnormalities noted. So the next thing we're going to do is we're going to go ahead and do the ophthalmoscope test, and I'm going to dim the lights for this just so I can see. So we're going to start with the red reflex, and then I'm going to look for the optic disc and the arteries and veins in the eye, and then I will turn the light back on and go through my findings. So I'm going to turn the light down. I'm just going to have you look, actually I'll turn it on. So I'm going to have you look straight forward and then kind of over my ear. It's pretty dark in here, so I'm going to start with your right eye. So light reflex is present. Okay. And then the left eye. Just gotta find the light, the red reflex again. Perfect. So the optic disc margins are good. They are intact. You can see the optic cup and the veins and arteries are visible. There's no clouding or abnormalities noted. I am going to switch to the otoscope to do the ear evaluation. I'm going to start with the right ear, and I'm just going to start with inspection. I'm going to start by looking at the external ear completely, the mastoid, the auricles, and the tragus. And then I'm going to go ahead and inspect the inner ear, looking at the ear canal and the tympanic membrane. There's no redness or inflammation to the ear canal. Tympanic membrane is able to be visualized. It is intact. No redness or inflammation noted. Now I'm going to go ahead and look at the left ear. Again, inspecting the mastoid, the trachea, and the auricles. Everything looks good. No redness, inflammation, or edema. I'm going to go ahead and insert and pull up and back. And the canal itself is good. No redness, just pink in color. And the tympanic membrane is intact with no inflammation noted. Now, what we're going to do is we're going to test your hearing. I'm going to have you occlude one of your ears, and I'm going to say a 2-syllable word, and I just need you to repeat after me. Fairy.
Fairy.
Now, if you could cover the other. Hot dog.
Hot dog.
Perfect. So the next thing we're going to do is we're going to use my fake tuning fork and do the Rhine test and the hearing test. So I'm going to strike my tuning fork and put it on the mastoid bone, I need you to tell me when you can hear it begin and end. Ready?
Hear it. It's done.
Can you hear it?
Yes.
And when it stops.
Stops.
Perfect. All right, so we're going to do the other side. I'll hit the tuning fork.
Hear it. Ends.
And can you hear it?
Yes.
Tell me when it stops.
Stops.
Perfect. So, gross auditory is intact to whisper and has a positive rhyme. The next thing we're going to do is I'm going to inspect and palpate the nose and sinuses. I'm going to put my hands on you and palpate your sinuses. Any tenderness?
Mm-mm.
So the maxillary and the temporal sinuses are non-tender, free of lesions. Now I'm going to inspect the nares. Okay, bear with me. I'm just gonna. Okay. Now on the other side, just gonna gently insert. So, no lesions, tenderness, deformities, any abnormalities, no drainage. The mucosa is pink and moist. Septum is midline or non-deviated. The next thing we're going to do is inspect the mouth and lips, the tongue, the soft palate, the oral palate, the hard palate, the gingiva, the teeth, and the let's see the other part, the pharynx and the tonsils. So just looking at your lips, please. So no cracking. If you could just open your mouth so I can see the corners. Perfect. Lips are pink with no abnormalities. If you could just open your mouth. Perfect. I'm going to use my fake tongue blade here and have you say ah. Make your tongue out farther. Thank you. So tonsils are not swollen. Uvula is midline, non-swollen. You can close. Okay. And then I just am going to inspect your teeth. Perfect. And open wide. Perfect. Teeth are aligned, no abnormalities, no missing teeth, no dental caries. Gums are pink without deformity or lesion. Tongue is midline without deformity. No bleeding or abnormalities noted. Soft palate is free of lesions and pink in color. Soft palate is free of lesions or any abnormalities that's pink in color. The uvula was not swollen or inflamed, and the tonsils were not swollen or inflamed and pink in color. The tongue had no abnormalities. The next thing I'm going to do is lymph nodes. So we're going to start with the preauricle, the postauricle, occipital behind your ears, your chin, and then we'll do your mandible and clavicle. So I'm just going to lightly palpate. Just let me know if you have any tenderness. Any tenderness?
No.
Any tenderness?
No.
Any tenderness?
No.
Okay. I'm going to just underneath your chin here. Yep. Bring your head down. Bring your head down and forward a little bit. Bring your chin. There you go. Any tenderness?
No.
Okay. Going to do your, so that was the mental. We're going to do your tonsillar lymph nodes. No swelling, inflammation, Any tenderness?
No.
The submandibular? Any swelling or any tenderness, excuse me?
No.
Okay, so the next ones that we're gonna do are gonna be your ones in your neck. So these are going to be your superficial cervical, your posterior, and your anterior cervical. So I just need you to turn to your left just a little bit so I can find your landmarks. Perfect. All right, and then come back midline. Okay, just gonna go now behind. Okay. All right. No inflammation, edema, abnormalities noted with the lymph nodes. They are mobile, not fixated, no hardness noted. So the next that we're going to do is the clavicular, subclavicular, and the, let's see, it'll be the supraclavicular and infraclavicular. So So unable to palpate lymph nodes, which means that they are, there's no lymphadenopathy, no abnormalities, swelling, tenderness, or issues, and that concludes our exam.